Oh, golf has almost been my life. I started playing when I was 11 years old and loved to play. Never thought I'd end up being a golf coach.
For more than 12 years now, Alan Kaufman has led the UAB men's golf team. But severe hip pain sidelined him several years ago. He couldn't even swing a club.
Oh, it was more pain at night. I couldn't sleep. I'd flip back and forth and back and forth.
Coach didn't have to look far for help.
Well, UAB is, the reputation it has in all different degrees of specialty. Logical place was to go to UAB.
Dark areas where there's cartilage.
UAB orthopedic surgeon and joint specialist Dr. David Moore operated on Coach Kauffman at the UAB Highlands facility.
Surgery. You can see on the side that he had replaced, he's lost this nice dark space where he's got cartilage left. You can see on this other side. On the affected side, there's this dark space represents an area where there was still some cartilage left, but he's down to bone on bone right through here. Some bone spurs have formed around the hip, and that's what was causing him the pain, is the loss of that joint space. So we restored his joint with a metal implant, again, that goes into this. There's a socket portion that fits into the pelvis there, a new ball that fits on top of a titanium stem that's down inside the femur.
UAB's Division of Orthopedic Surgery performs about 1,000 joint replacement surgeries every year. And with the aging population, there will be an even greater need among younger patients.
As the baby boomers are hitting the 55 to 65 age group, it's a very active group of folks, and they want to continue to do the activities that they've enjoyed all their lives, and hopefully these newer implants are going to allow us to accommodate those desires.
Today's implants are much more durable, meaning hip replacements can be done at an earlier age. Patients with hip problems most often notice groin pain first.
But we want to know what the patient's expectations are, how much they're limited by their hip, and if they've truly failed conservative measures. And if all those things are the case, then we discuss the option of hip replacement surgery.
The surgery takes about an hour. Patients spend 2 to 3 days in the hospital. The UAB Highlands facility on Birmingham's south side has operating rooms and staff dedicated to orthopedic surgery.
We moved to Highlands several years ago, and universally the patients have been happier with their experience getting in and out of clinic. Parking's easier, everything's closer than what we've had across the street. Same expertise, but hopefully a little bit more of a community hospital type feel.
Patient care before and after the surgery is always a priority.
But the thing that impressed me was the interest that Dr. Moore and his staff had. His top assistant would call, be sure everything was all right. If I had a question, they were there to answer.
For Coach Kaufman, a new hip has meant a new lease on life.
It was night and day. Feel like I had the original hip.
I think that's the reason that I'm doing what I'm doing, is because it's one of the few areas of medicine where you can go spend an hour or so in the operating room and really restore somebody's quality of life and restore them to the activities that they enjoy doing.